Nina Chernick. I guess I'll say a bit about why I wanted you to come on first. So
Okay.
I wanted to speak with you because you're one of my favorite Upledger craniosacral teachers that I've had. Um, I think it was 2018 where you were my instructor for Craniosacral 2 in Montreal. I think it was 2018.
Okay.
And you also were my instructor for SER 2 I think that was also in Montreal. No, SER 1. SER 1,
So I run in
not SER
Montreal.
2. Yeah.
Yeah.
And
That
I
was a
was,
good class. That was a juicy, fabulous year class.
do
So
you remember
good.
that?
Yes, because I think I only ever did, in my memory, I feel like I only ever taught SER1 in Montreal once, and wasn't it a really good sized class? Like it wasn't tiny or anything. There was a good
Mm-hmm.
number of people, and it was a really cool mix. And I remember that class very, very well. Yeah,
Oh,
it
that's so
was a
cool.
good one.
I want to tell you a little bit more about my experience in that class actually a bit later on. That's really
Okay.
cool that you actually remember that.
You too.
So I've also assisted you on a CS1 class in Toronto. I think that was
Yeah.
even during COVID or just coming out of COVID or something. And
Yeah.
you were also my examiner for when I did my technique certification to become
Yeah.
a Upledger CST practitioner.
I
And I just
remember
got to say,
that.
the thing I really appreciate about your teaching style, and this isn't just coming from me, this is feedback I've gotten from other students too, so it's not just me saying
Okay.
this, is that, craniosacral therapy, which is probably going to be the bulk of what we talk about today, being that's one of your expertise, CST, it can have a bit of a reputation of being a bit out there, a bit
Yeah.
mysterious, and some some people consider it not really to be grounded in scientific evidence, and there are
Hmm.
things that we're observing and palpating in the body that we might still not know the exact mechanisms behind or have direct access to touch with our fingertips. But I really loved that with your understanding of the body and your experience, you've always been able to describe what we're doing in craniosacral in real physiological terms and address students' areas of uncertainty with confidence and with your best scientific rationale for what's going on. And what this did for me as a student is it really helped me to believe in this form of manual therapy and buy into it because I don't know if you know this, but I came into craniosacral therapy pretty resistant to it. I didn't,
Wow.
yeah,
Wow.
even
Say
though,
more. Say more.
okay. I mean, even though I invested thousands of dollars to take this course, even coming into it, I was like, what's this gonna do? But yeah, because when I heard about craniosacral, it was from someone who is a bit more in the fluffy, energetic world of Reiki and things, which craniosacral is not Reiki. And I was like, oh yeah, whatever. But then I started meeting people that I respected who were practicing craniosacral, and that made me start to think about it a little bit differently. And then I had a treatment myself that really blew me away, and I felt completely different after that treatment. So I was like, all right, I guess I'll see what I can do. But still, I wasn't really bought into there was any kind of science behind it. You know,
Mm,
we're palpating these deep layers within the skull, but we can't actually touch them with our fingertips. So how the heck, what are we
right.
actually doing? Are we just imagining it? Is it just
Right.
some kind of energetic thing that only some special people have access to? So I wasn't sure if I could believe that I could actually do it. But you, with your amazing ability to describe things in concrete ways, you helped me buy into it that yes, we can palpate these more subtle layers of the body. And even through really delicate application of force, we really can make profound changes in someone's systems. And I wasn't just imagining it. And these fluffy, energetic people who were doing this work, maybe there was something to it. They weren't full of shit.
Right.
And
Right.
I've taken some craniosacral 1 classes, and I haven't found that the teachers, they were really amazing. Like all the teachers in Upledger are incredible, but some
For
of
sure.
them don't have the same kind of ability to describe the
Mm.
the physiology, the way that I've heard you describe things. For example, you get a complex question in class sometimes, and instead of saying something like, "Oh, why don't you just give it a try and see what you feel for yourself, which is what some teachers will say. Because, yeah, you really want people to feel with their hands and
Yeah.
create their own, get their own answer to their question, which is possible. But also, I really appreciated that you'd say something concrete as well as saying, go see what you feel with your hands. You'd give me something that is a
Nice.
bit more of a buy-in for me, if that makes sense. So I really love that. Anyway, so this podcast, Movement Detectivery, is about getting deeply curious about the body and understanding how it works so people can get inspired to help themselves with different ways of moving, different manual therapy modalities, because manual therapy, I think, is a component of understanding our bodies better, both the giving of and receiving of. And
Mm,
I know that you have a lot of depth of understanding across various modalities and various populations. So I'm really dying to ask you a bit more about your own journey with your body and
for
about some
sure.
of your philosophies and ways of working and yeah, and how you came to be such a smarty pants. So maybe we can start with a little bit about maybe you can tell the people listening, all seven of them, what is your professional title currently?
Okay. So my professional title, I would be, um, I guess to some degree, a bachelor in kinesiology, registered massage therapist, craniosacral therapist. And that's one of my ways of introducing myself, but my kind of like cocktail party name, my cocktail party label would be manual therapist, which means who knows what, or manual medicine practitioner, something along those lines, because it allows me to answer the question, oh, what do you do for a living? And also not get put in a box of, oh, you're a fill in the blank. And then the person is then putting you in that box and thinking, this is what you do and picturing what I do. And that I think is too limiting. So I use a rather amorphous term in a way, which is, or non-specific term, which is manual therapist or manual medicine practitioner.
And so you have a kinesiology degree, which means something very different in Australia compared to Canada, I think. Um, and
Here
you,
it means basically phys ed. So
yeah,
I got a degree for doing sports.
that's awesome. What sports did you do as when you were younger or currently do? Do you do anything now?
I do. When I was younger, I did gymnastics, soccer, water polo, water skiing, snow skiing, or like alpine and cross country. And now I do probably more cross country. I play tennis. And I don't know, these are not really sports, doing Pilates and yoga, I guess they're more movement practices. And I walk and I hike. They're not so sports, but like I guess I'm in competition with myself a little bit. And I strength train. So that's my like, yeah, big competition with myself.
Great. And do you do any movement-based things with clients, or are you 100% manual therapy in your clinical practice?
So my orientation, and maybe this is also maybe was a draw, anything to do like movement is I'm oriented, I would say, in terms of movement, in terms of the concept of things being dynamic. So whether that's the way that we're thinking, the way that we're looking at someone's body, the way that we're encouraging someone to interact with themselves, that there's a dynamic component to it. So I would say that my background, like my university background, let's say, and then the the studying and practicing myself, I will bring exercises, I will bring different movements in as suggestions when people say, "Do you have suggestions for self-care?"
Hmm. I love personally the way that craniosacral and movement can go together. I want to maybe ask you a little bit more about that later on, but I just want to get a sense of your timeline first. So you got into kinesiology when, and then was it massage therapy
Yeah,
after that? And then what was the next thing? Because I know you teach and use acupuncture
true, true.
and
So
craniosacral.
I had, I guess I say the lucky opportunity in massage therapy. So I went to massage therapy school. I didn't really know what to do with myself after university, after 4 years of university, and then backpacking around Southeast Asia. I came back and I was like, oh, what am I going to do? And it was suggested to me, hey, you should check out this massage therapy because it's body focused and sport oriented and it's very physical and I think you'll really like it. So I thought, well, it's whatever, 2.5 years, the training, whatever it was. Okay, well, I just did 4 years, 2.5 seems like nothing, so I'll go do that. At the end of that school, at the end of, I went to a school which I don't know if the seven people of anyone has an awareness of Sutherland Chan, it was a really cool grassroots school, which was started in Toronto by two women, very cool, and it's burgeoned into, a whole thing. But at the end of that training, there was a teacher who taught a course that was called indirect palpation. So indirect palpation means what does that actually even mean? Who knows, right? It was perfect. So she called it that because she didn't want to call it craniosacral therapy because she wasn't an instructor, but she probably just had taken some courses. So she, taught us to do this type of palpation. And I had an experience with it where I I can't really explain this to you exactly, but I saw my friend's sacrum moving. Okay, we'll leave it at that. I don't know. So I was kind of curious, and Upledger then came, a representative had contacted the school and said, "We're going to bring a course and offer it at the school." Amazing. Student at the student price, because I had no money by that point. And it fell through, and they instead gave us a student discount, and we went down to a hotel in downtown Toronto, and I had the experience of Cranial One. And so I had it, then I shortly after that I graduated, so I had that experience with me as I started out into a sort of a classic massage therapy type of practice.
Wow. So were you one of the first people in Toronto to be able to do craniosacral level one at the time then?
I was It's a really good question because I know who the instructor was, and they were what I would think I would have called in the past second generation. So, when you think about John Upledger and then the initial, like the group who he started to train, who were non-osteopaths, so that was a big deal. And then there was almost next generation. I think these people were in the second generation. And then I always thought of myself as being in the third generation.
Hmm.
And so there were people practicing in Toronto. I could probably list off a number of, the individuals who were practicing at that time. So it was really getting going. And that was in 1991.
When did you start teaching for Upledger Institute?
So I started teaching for them. My first class I taught by myself was in July of 1997.
Oh man, I would have been 7 years old at that point.
Too young to attend. I wouldn't have
Yeah.
been in.
So you mentioned that you had that interesting experience with indirect techniques and
Yeah,
that
indirect
got you,
palpation, exactly.
yeah, and you could see, quote unquote, your partner's sacrum moving. And did that inspire you to receive craniosacral therapy as a treatment for yourself before signing up to do some
Oh,
training?
right. And the answer is no. And it's sort of embarrassing really to say that in a sense. Like, wow, that's not a very good model, Nina. I I had I had a little bit, how shall I say, I'm trying to be generous to myself. My view, my experience with body work was very, very limited. I had received some physiotherapy in university, in conjunction with competition and athletics and, injuries and such.
Mhm.
But I wouldn't say that I was really particularly savvy about body work. And that was at the end of massage therapy school. And I had some really mm, rigid concepts. Sometimes school can be a little bit black and white
Mm.
philosophically. And I came out and I had some ideas. And some of those ideas I might still espouse, and some of them I've let go. They were a little bit more rigid.
Mm.
So I also, I don't think I would have known where to go.
Mm. To receive.
Yeah.
Yeah. So when did you have your first treatment for yourself? Was it in the course?
I think it was in the chorus in the cranial.
Really?
And I can't actually remember, oddly, I can't remember being treated in that course. I mean, obviously, but I was exchanging with my friends. Like, I went actually with a group of friends.
Mhm.
And so we were all being partners with each other. And I don't remember particularly the body work at that time. I remember I remember it later on, like in the other courses for sure, very like huge clear memories
Mm.
of some of the treatments and such. But I I definitely liked it. I was definitely drawn to it right away, but I did not get it. I did not understand it.
Really?
Really, really.
So what was going
Yeah.
on in your mind when you were in your first cranial course?
It was some combination between, so I'd just been, at school for not 6 years straight, but with a little break in there. And I think I was just trying to get through it. Like at lunchtime, we would just sleep on the mattresses. Uh, my idea of it, or what I took from it was, this is really cool. I don't understand it, but I'm going to practice it. And what I did was, I just sort of went through, here's my book and here's step one. Okay, diaphragm releases. Okay, one hand anterior, one hand posterior. Okay, add 1 gram at a time from top hand to bottom hand. And so I started to integrate it immediately with friends and family and patients and just doing the technical piece, but not necessarily, I think in my mind, not necessarily connecting with the tissue or becoming engaged with the tissue.
Mm. So that's a big concept in craniosacral therapy. So maybe you can take this as a segue to say a little bit more about that. What does it mean to, you already mentioned this idea of indirect touch. What does it mean to connect with the body in craniosacral work? How is that different than doing massage therapy or other kinds of manual therapy?
So this idea of engagement is interesting because, we can take the concept and we can apply it to all sorts of cool things. We can apply it to, we're having a conversation right now and we're both very engaged in the conversation, right? Or you're taking a course and the hours, the time flies by because you're really, really engaged. You could use the word focused. But in cranial, the idea of engaged in the tissue is this idea of meeting the tissue. So again, we could look at that on different levels. We could think about being able to be physically meeting the tissue, right? So hand touching right up against the tissue. And that idea is quite different than a number of other applications where we're continuously doing. I'm thinking about, kind of a lovely Swedish massage, effleurage or something, where we're doing something with the tissue. We're doing something to the tissue. We're applying force, we're to the tissue, and we're seeing how does the tissue respond to that. Whereas this idea of engagement is first meet the tissue, make a connection. Now we're connected to the tissue, we're connected to the system, and we can start to gather information. So then you can extrapolate, you can take that and say, meeting the tissue. So once you're meeting the tissue, there is so much information that the tissue then can relay to your hands. So that could be, what is the tension in the tissue? Or is there a pull? Is it pulling you in a certain direction? Is that tension changing or is that tone changing? Is it softening? Are you then being drawn in deeper to the tissue? So this idea of engagement is, I think you could use another term and say connected, but it's a connection that is very specific and limited. And that limited connection is, it's not the connection like if we see each other and we hug. So when we hug, we're connecting on lots of different surfaces and we're connecting on different levels as well. And because the concept of this work or the backdrop of this work is therapeutic, the meeting is limited. It's full, like it's 100%, but it's limited. And we limit it to this aspect. We can think of the wrist down, right? To the just the hands. And my analogy for that, which I'm sure you've heard many times, is if we want to see what's the water like, right? We're going to go to the pool. What's the water like? Most of us, we wouldn't just jump in. We're going to take a hand, we're going to dip our hand, we're going to dip a finger. And by doing that, we keep our perspective. And the idea behind that connecting or engaging, or what you'll hear the term is blending or melding, is that we do that up to the wrist. So we have this full connection, keeping the rest of ourselves separate, and that keeps our perspective on what's happening and keeps it in the therapeutic realm.
Mm. And that is very different to how you would learn to work with muscles in massage therapy or as a someone who does joint manipulations or mobilizations.
Sure,
So,
for
what do you
sure.
think is the I don't want to be biased, but I am biased because I prefer to receive and to use more of a craniosacral style of touch. I
Yeah.
think it has quite a different effect on the entire system of a person. But what have you seen? What do you feel is maybe an advantage of working in this way? Not to say that massage and adjustments are not beneficial in any way, but what do you see as the advantage of this more blending and melding and the craniosacral style of touch?
So I think there are a couple of very practical advantages. And one is when we work with people who are experiencing pain at this time, pain or discomfort or distress, and this type of touch tends to, because of the application, because of the way it's done, it tends to stimulate the parasympathetic aspect of the autonomic nervous system. And there can be a noticeable relaxation for the patient and a decrease because of that increase. There's our little volume knobs, right, of sympathetic and parasympathetic. That increase in parasympathetic and maybe at the same time that decrease in sympathetic is going to directly decrease or at least not increase any pain or distress that the person is experiencing.
Mm.
So practically, I think it can be such a great application in that situation. The other thing about the touch is in a lot of forms of manual therapy, excellent forms of manual therapy, again, the therapist is doing something to the patient. And I it's not necessarily that the philosophy of I'm going to fix this person, but the movement of, if you want to speak about energy or intention, is very much from the practitioner to the patient.
Mm.
And in cranial, the whole relationship is different. And it's this idea that we connect and then we invite the information to come from the patient to the practitioner.
Mm.
So there's a different, it's not that we're not doing anything, but our attempt is very much to facilitate, right? So make facile as opposed to fix or do.
Mm. Yes. And the way you describe it like that just puts me in this imaginary situation of meeting somebody for the first time and trying to have a conversation with them and meeting a person who doesn't engage with you and they just talk at you and you feel like you're getting bulldozed by them and you don't really feel like you've made that connection. And when you mentioned sympathetic versus parasympathetic in that kind of context of a conversation with somebody, if they were just speaking at me and I didn't have a chance to feel seen, I'd have my guard up a little bit. I'd feel a bit more sympathetically activated. And I don't think I'd be very flexible in that moment. I don't think I'd be very open to changing or revealing much about my
Yeah.
state if I felt like I was being what's the word? Yeah, someone with a megaphone yelling at me and trying to lead the conversation maybe in a way that I didn't like or I felt was too much or like I don't like this topic of conversation. Why can't we make it a bit
Yeah,
more, of a teamwork together?
really.
To me, the way that you described it just reminded me of, oh yeah, I would rather be treated like I'm being met and engaged with and that you want to hear from me versus you're going to do this conversation to me.
Yeah, yeah, exactly, exactly. And it's, you know, obviously there are lots of there are different styles and there are different things that do work
Mm,
in, in different situations. Like if you're going to have surgery, the surgeon is going to do surgery on you. Now, I could argue that you play a part because you can prepare yourself the best you can, especially if it's a situation where you get to prepare in some way, right? So it doesn't really make you an active participant, maybe in that moment when you're having the surgery, but pre, post, right? If you do the exercises, if you eat well to regrow your tissue. So I think that there is, if it's okay to use this word, there's a relationship. And we're creating a relationship. And obviously there's the greater therapeutic relationship, which we want to create with our healthy boundaries and our professionalism and all of the pieces that we bring to a session. And then there is the relationship that's being created, that external, going back to, the speaking, right? Which is significant. And then there's a relationship that's more on the tissue level, where that is, right? There's a relationship now that's being created with meeting the tissue and the type of touch that is being used to create that, yeah, I guess to create that relationship.
mm. There's this understanding in cranial work that everybody has an inner wisdom, and that what we're really trying to do is communicate with that inner wisdom inside, or is inside the best word? But
Yeah,
trying
it
to
seems like it's
communicate with the
inside,
inner wisdom of
somewhere, wherever
our
it is,
client,
wherever it is. Yeah.
wherever it is, it's everywhere.
Um,
Um, and I found this personally working with that idea to be so liberating for me. When you come from the paradigm of trying to fix someone, like you mentioned, or you trying to have the idea about what that person needs, it really limits us from being able to understand that maybe this person's body already has an answer for what they need. And if we could listen to that a bit better, then we could really use less of our own intellectual energy to try to help this person and just be guided by what that person's body is already telling us that it needs. What is this inner wisdom thing? Because I think that's what you're speaking about when you say engage with the tissues and listen to the information. What is inner wisdom? I think that's a massive concept that can really open up
mhm.
people's minds to a different way of working with bodies.
Totally. So really, really simply, when if that concept comes up about inner wisdom and to be fair, also people may have another name for it. Maybe they say the part of me that knows. I say that to people sometimes. You know that part of you that knows things. You know that part of you that sometimes you check in with, like, do I really want to go out to that, to the bar tonight? Or do I really want to go see that movie? No, I really actually want to stay home. I want, everyone's trying to get me to go and I'm trying to convince myself. But if I check in actually with myself, what's the message that's coming through? And so inner wisdom, everyone has inner wisdom. Everyone has that part of themselves, sixth sense, gut, and maybe intuition, whatever the name is, guide, whatever that is. And I think that there are two parts to it. There is the part in terms of the practitioner, and then there's the part in terms of the patient. And for the patient who's on the table, sometimes one of the conflicts that restricts a resolution, and if you like to use a different word than resolution, think of tissue healing or resolving a restriction in the tissue or resolving an injury. One of the things that can get in the way is that something has occurred and we haven't consciously recognized the effect that it's had. And I have a beautiful example of that uh, recently with a patient who'd had an injury and had a great repair from it. And the person didn't consciously recognize how affected they were by this injury, like how much it changed their life and how it changed some pieces about how they felt about themselves. And so connecting on the table with the part of them that knows things, and that's how that was comfortable. Inner wisdom, maybe that term didn't have a meaning for them. So we used, the part of you that knows things, or maybe that part of your body that has, this wisdom in it. And that can be very, very powerful, I think, for people because we hold a lot of knowledge about ourselves. And some of us spend a little more time working with that and becoming maybe a little bit more self-aware. And just like with any relationship, if we build our relationship, it becomes really strong. It becomes easier and easier to connect with that inner wisdom or that information that's very valuable. As a practitioner, as a practitioner, because you're a person, also you have your own inner wisdom to work with. And then there's an incredible possibility of connecting with the patient's inner wisdom and gaining direction. You could say gaining information, but I'm going to say gaining direction as to, okay, I'm here to facilitate. I'm here to help. What can I do? And where shall I go? And that kind of information is there for us to receive, but we have to be in the mode. We have to be in reception mode as opposed to maybe not as receptive. I was going to go off and say, thinking that we know everything,
Hmm.
but I decided to be more
Yeah.
diplomatic.
It really is such a difference in presence that you need to use that style of work of inner wisdom to inner wisdom. Um, I'm just remembering my first experience ever with physiotherapy was very much a let's do some modalities, and I didn't feel like I was in any part a participant in that process, but nor did I know any better. I thought I was getting really good care because I got all the modalities. I got the heat pad and the like those little electro-stimulating zapper thingies, and I got chiropractic adjustments and massage therapy and the whole shebang. And I thought I was getting the best care ever, but never once was I being asked to step into the picture or being consulted with about what does my body really need. And this was for a hamstring injury. So I would not have thought about getting craniosacral for a hamstring injury. But then, let's fast forward, I don't know, 5, 6 years when I first received craniosacral therapy. I was having a lot of problems with my left hip, which was the hamstring that I injured. And my legs just never felt quite the same. I always felt a little off kilter and imbalanced. And I knew I still had some restrictions from that hamstring injury. And this first cranial session that I had, it was very informal. It was kind of impromptu. So it was really just a frontal hold. And it was a long hold. It was maybe, I don't know, I lost track of time and space as you do. And it must have been about a half an hour just working with my frontal bone. And I remember standing up after that and walking around and feeling the most balanced my legs have ever felt. So I tell this story because I'd love to hear you speak about when somebody has a musculoskeletal problem that isn't necessarily within the craniosacral system. Um,
Mhm.
but how can craniosacral therapy actually help with the whole body? Because we think about it as the cranium and the sacrum and the spine in
Right.
between and the membrane system and the fluid circulation. But for me, it had such a massive impact on old musculoskeletal injuries. So, do you have anything you could share about why it's so impactful for the whole body and it's not just for like a head bonk or a concussion or something like that?
Absolutely. So we can look at a couple of different pieces. So one, I think one good place to start is we can look at the autonomic nervous system. And the autonomic nervous system, without spending our entire time together and talking about which we easily could, because this aspect of our nervous system is, I think, very, very complex, very, very interesting, very involved. And we're still learning, we're continuing to learn about where these two different types of fibers, the sympathetic fibers and the parasympathetic fibers, where and how these affect all sorts of areas and functions in our body. So really quite amazing. So one piece of the relevance or the application of cranial for something that isn't directly related to, the dura, that is not directly part of this concept that we call the craniosacral system, is affecting the autonomic nervous system will change the tone in areas of the body where the tone is higher. So someone lovingly and hopefully, as professionally as possible, apply this lovely frontal lift or just, hands on different bones of the cranium and follow the cranial rhythm and encouraged it or did a technique, which we call still point, which is very stimulating again to the parasympathetic fibers, the parasympathetic aspect of the autonomic system. And what we can see in the body in real time are tonal changes. And what we don't necessarily recognize as the patient on the table or as we're walking through our, going through our day, we don't really have uh, receptors in our body that give us information about tone. You might say, "Oh, I'm feeling tight today." But that doesn't necessarily give you information about an area and what is keeping it limited. So the autonomic piece seems to have a systemic effect. So meaning you can then work one area of the body and have an incredible effect in another area of the body.
Hmm.
And that's generally because of autonomic change, which
Hmm.
is pretty amazing and whole body. And then the other piece is craniosacral therapy. The medium that we're working with is connective tissue. And so we're interacting directly with the vascular system. And when you change blood flow, when you affect the vascular system, you also get change in real time, tonal change and changes in blood flow, changes in perfusion. And that changes the messages through the nerves. So what that means really is can you use craniosacral therapy in treatment of many different presentations, maybe musculoskeletal issues, maybe directly orthopedic issues, maybe visceral issues, it's all, those are definitely, those are going to be appropriate applications.
Mm. Yeah, I love that. And I didn't know that there is no such thing as a tone receptor in your body. Just that you might feel tight,
Well,
but you don't know
there's
why.
right. I think that we have amazing, obviously we have different kinds of nerves and different receptors that bring the messages back to the spinal cord, of course, and up to the brain, to the higher centers of the brain. And however, we don't have receptors for everything. Like we don't have non-movement receptors.
Right.
If there is something that's not moving well.
We don't really know about it. Yeah, that's so fascinating. And a lot of people listening to this, all seven of them, are mostly movement nerds who love
Right.
exploring movement. And that brings me back to something that I mentioned a bit earlier. I wanted to ask you about movement in your life and if you use it in your practice. But I see a lot of people who are looking to help themselves move better, and I use craniosacral as part of that in our sessions together. And I was wondering if you have any experience of using craniosacral and helping people with movement within a session, and how do those go together for you if they do?
Yeah, that's a really good question. Maybe this is too simplistic, but I will do pre-testing and post-testing.
Hmm.
And in craniosacral therapy, not to get into the minutia of the techniques, because I don't think that'll be interesting for any of the level seven, the great seven, the super seven. But there are techniques for assessment. There's some very, very good ones. I mean, arcing is a technique which we use, which it's kind of a highlight of my teaching weekend when I get to teach people how to do that technique. I feel like it's like getting to give everyone a little, birthday present on their birthday. Because it's such a great technique. It's such a gift to, pass it on. And so I use that, but I also pre-test and post-test.
Mm,
And I could it's kind of clinically relevant. So maybe I'll say that little piece quickly, which is the value of pre-testing and post-testing is that it demonstrates to the practitioner, oh, we're on the right track.
hmm
And it demonstrates to the patient, we're making change.
hmm
Right? So pre-test and post-test. So within that pre and post testing, there could be movement. So maybe we're doing a movement that the person is having trouble with, a movement that's been challenging for them. Maybe it's part of their sport. So I had a pitcher the other day, baseball pitcher, and we were looking at the point in the pitch, the point in that movement pattern where they were having discomfort.
mm,
And so part of it was for them to do the movement and feel how that moved, feel how it felt, and then do it after the treatment or at interim points during the treatment. And also obviously for me to see the movement and, get some better understanding about maybe something that they were doing with their body.
mm,
So I use it in that way for sure. And maybe also that the pre-test and post-test is a a yoga movement. Okay, we're gonna, our pre-test and post-test is gonna be having you move from being on all fours to moving into a cobra move, or a nice back extension, and seeing what the ease is of that, or seeing if you can actually get some extension through the upper thoracic spine,
mm.
and pre-testing and post-testing with that. So
Yeah.
that's really, I would say those are the main ways in which I would bring movement into the session.
Yeah, that's wonderful. And like you said, it's a great opportunity to reintroduce some challenging movements when they've had that change and softening in their autonomic nervous system, reduced tone, better blood flow. it's a perfect window of opportunity to explore movement in a new way. And I've found that for myself that I always get excited after receiving something like craniosacral or even acupuncture when I experience that whole body change it gives me. I love to go and do a nice movement practice afterwards because I know I'll have so much more I can access and make greater changes to in my system post. But you mentioned arcing, and I think this is a great transition to describe what that is. What is an energy cyst? And why are those important to work with? Why is that such a solid concept in CST that we work with? And yeah, tell me about arcing, and I want to tell you my story about when you first taught me how to arc.
Okay, amazing. Well, I'm excited. I'm excited to hear this. So arcing is a technique that Dr. John Upledger came up with and experientially, and he described it as being able to feel a disruption, an energetic disruption in the tissues in the body, and having that disruption continue to disrupt out through the medium of the body that we work with, which would be, the tissues, the connective tissues. So the analogy is always a pebble dropped into a pond. And as that pebble disrupts the medium of the water, those arcs, those pieces of circles get bigger and bigger and bigger, less powerful as they move away, more powerful, tighter as they are closer to the source of the disruption. The explanation of an energy cyst, which is demonstrated when we arc, is this concept that, which is really very, very cool, which is that we spend our whole day managing energy, right? That's what our tissues do. And the greatest managing force. And the greatest force that we have to deal with is gravity, right? And then if we increase our speed, the amount of force we have to manage goes higher if we're going up an incline, if we put more weight on, like we're rocking. And so that's what we're all about is force management.
Hmm.
And sometimes what happens in our lives is force comes into the tissues from away. So for example, someone gets hit uh, by a ball. So force comes and hits the tissue, and the tissue, the design of the tissue is to dissipate it, right? So just dissipate that force. And in many situations, many, that's what happens. The idea of the energy cyst is that if certain situations, if certain conditions are set up, that maybe the dissipation of that force is not possible. So if the force is too great for the tissue to manage and to dissipate it, or if the condition of the tissues where the force enters, maybe those are deconditioned. Maybe they're not as healthy. Maybe they've been injured in the past. And then there's this whole other component, which is fascinating, which is the emotional state, excuse me, of the person at the time of the introduction of the force. And which lends itself to the idea like, something happens, like you trip and you land on the ground and we go, oh my gosh, are you okay? And you go, yeah, I think I'm okay. You get up, you move, right? Maybe you rub. And we think about this concept of shake it off, right? Shake it off, dissipate that force. And sometimes that's absolutely possible. But with this concept of energy cysts, the idea is that you're not able to shake it off. You're not able to just dissipate that force. And so the body walls it off. And according to Dr. Upledger's work, this the idea of of an energy cyst had the movement was almost like an agitator, and it was about 40 to 60 cycles per minute, which felt disruptive when you put your hands on to arc or when you tune in to do this arcing to look for this disruption. And the disruption, if you think about it, that force is from outside of the body, so it's foreign. It doesn't get blended into the tissues. It's entropic, right? It's moving toward chaos. and it can disrupt the tissue health, whether that's the connective tissue or bony tissue or vascular tissue or neural tissue, whatever it is that it's interacting with.
Mm. So someone who maybe had a energy cyst, let's say something happened in their hip, just for example, would that also show up as limitation in how they can move through that area?
It's an excellent question because there's sort of two possibilities. So one is that the site of pain, the site of symptoms, is the same as the site of dysfunction. So something happens and someone, let's say someone's riding a bike and they hit a pedestrian, okay, and pedestrian is injured. Probably the cyclist is injured too, but the pedestrian is injured, and the contact maybe of the bike is to the hip, right? It's to the maybe it's to the lateral aspect, the side of the hip, or the side of the leg, and there's a bruise there, and it correlates. It correlates to the injury site. And sometimes when you think about energy and you think about force and how uh, like lightning, for example, is a great example because if lightning enters something, it goes in the path of least resistance until something stops it. And this is exactly the same thing that we see. So sometimes the energy cyst formation is not directly at the site of the injury. It may be in another area because of the force continuing through the tissue until something stopped it.
Mhm.
What we might see is dysfunction in the form of limitation in range of motion, or maybe change to the tissue over time, maybe some trophic change in the area, meaning that the change in health of the tissue in terms of the vitality of the tissue itself, in terms of the perfusion of the tissue itself. So, and the other thing is there could be contribution to nerve sensitization. So there may be at the area of the energy cyst itself, there may be symptoms that present. And that's one possibility. And the other is that it affects other areas, and we see almost like a compensatory change
Mm.
demonstrated. So the symptoms are actually over here in this other
Mm.
area, whereas the origin is demonstrated. A beautiful example of that is a patient who had a surgical intervention in the shoulder, and the restriction and the symptoms presenting actually in the contralateral hip or
Mm.
contralateral pelvis.
So which was the energy cyst? The hip or the...
There were, right. So the energy cyst was definitely at the shoulder,
Mm.
at the area of the initial injury and surgical intervention.
Right.
And there was, in this situation, was there an energy cyst also in the hip? And at this moment, I can't seem to remember that, but I'm going to say in the shoulder.
Yeah. Well, it's good to think about in terms of compensations as well. With your example of getting hit in the leg by a bicycle, that might be the site of there's an energy cyst. That area was not able to dissipate the force. And would it be fair to say that you wouldn't necessarily want to load that tissue, say in the walking cycle? You might not want to completely shift your weight through that leg to load those lateral hip tissues if there's an energy cyst there. You might not be aware that there's a problem with that part of your body, but it might create compensation elsewhere because you're avoiding loading that particular tissue of the hip.
Sure. For sure.
That's so interesting.
You know how there's a big piece for us around, again, this demonstration of discomfort or dysfunction in an area, but it's not the origin.
Mm.
And I think we could add a really nice little piece in for our learning around arcing in that one of the really lovely aspects of arcing is it doesn't necessarily demonstrate symptom.
Hmm. Right.
It demonstrates disruption. So it really gives us more of, hey, what are you feeling? What's going on for you? Okay, thank you so much. That's great information. And then I'm going to arc and I almost think of it like I'm interviewing you first and I'm saying, tell me all about it. Tell me what happened. Tell me how you're doing now. What are you having trouble with? What makes it better? What makes it worse? And then, okay, thank you so much. And now we're going to interview your tissues.
Mm.
And when we interview the tissues, we're not saying, where does it hurt? Or where are the symptoms? We're saying, where's the disruption?
Right.
So it's a different piece of information. And often that piece of information is so incredibly valuable because the patient is not necessarily able to provide that information.
Right. A lot of people forget injuries, even if they were really massive ones. But if you ask their system through arcing, hey, show me the disruption, we're connecting with the part of them that does know and remembers that in their tissues. And that's so valuable to have that as a tool. I I remember when I first did CS2, where we learn arcing in the curriculum. I was having a little meltdown. You probably didn't know, but I think we had, prior to learning arcing, we learned all the sphenobasilar dysfunction technique.
Yes, yes,
And
yeah.
I think I was a little stirred up from that because I had quite a bit going on. But I also, you remember I told you I came into craniosacral quite resistant initially. I was even more resistant about arcing. And maybe not resistant, but I just didn't believe it was possible. And I thought it was still in the land of this is energetic bullshit. There's no way this is going to work. I'm not going to feel anything. Oh my God, what if I don't feel anything? I'm going to fail this class. Oh my God, I'm such a bad practitioner. I'm not going to
What's
get
wrong
it.
with
And
me?
it was spinning in my mind. And I was standing outside class and I was literally crying because I was so worried that I wasn't going to be able to do it. And I was partnered up with this really lovely French man and he was trying to console me, like, oh, it's okay. We're all just learning. It's all new. Um, and then I remember the first time I was just like, okay, whatever. I'm here. I paid the money. I might as well just like try to be open minded about this arcing thing. And I remember the first time I just put my hands on the body. And for me, it was just contact with the feet. And I just felt this energetic pull to a part of their body. And I was like, oh shit, this is real. I can actually do this. And it was incredible. Um, yeah, I can't explain it. I don't know the scientific basis for how we can feel into these things in the body, only that if someone as resistant as me could learn to do it, then it must be real because I'm not making it up.
Right? Yeah. Yeah. And having the confirmation or validation from a patient
Mm,
of being, of noticing an area and articulating that and having the patient say, well, I actually, I had this the other day where someone said, well, actually, I fractured a bone in that foot and I didn't remember it. It
mm.
was 10 years ago, it was 20 years ago, whatever it was. And so that does really validate, hey, I'm not making this up. Otherwise, wow, that's a pretty big coincidence that I went to that place on their foot where there was an injury in the past.
Yeah, not a coincidence.
I don't think so.
And maybe this is a good segue into SCR, somatoemotional release, and how this fits in within craniosacral therapy. And I told you earlier I recently reattended SCR1 in Brisbane,
Yes,
and
amazing.
I can't remember, it was 2018 or 19 when I did it with you for the first time. And again, I was a very resistant person to SER. And it's funny now just saying all this. How did I even go through with this curriculum considering how lack
That's what
of
I'm thinking. Oh my gosh, you're
I
so
was
resistant, but you just made yourself and made yourself keep going.
the part of me that knew that I needed to do it.
Hey,
But
this part, that's all we need is that part.
right. So in 2018 when I did it, I guess you could say I was a bit more emotionally not intelligent. I had, as we all do, layers that I hadn't worked through in my own life of belief systems and traumas and things that my body for sure remembered happened, but I was not ready yet to work with, maybe a bit armored up and protective. So that part of me that was still very protective was like, hell no, I don't want to access this, especially not in a public room with other
Yeah,
people.
fair,
So when we were
fair.
getting on the table and deliberately trying to elicit imagery that helps you to connect with these memories in the tissue that might have some emotional charge to them, I could feel myself going, nope, 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 we're not going there. And so I don't know how much personally I engaged in that way, but there is still the part of me that could see, wow, there's such value in this. And why is it that I'm not letting myself fully participate? Maybe I should get to understand that part of me that's putting up this barrier. And then SER2, I was a bit more like, oh, okay, I've paid another $1,000. I better just like go all in on this. And I did. And you know what? A part of me was also judging
Good for
people in the room.
you.
Thank you, thank you. But you know how there's some people, I don't know, I don't want to speak ill of anybody who takes these courses, but I always get the vibe that there are some people in the room that make it a bit more about them and them having an opportunity to have a big emotional release versus them actually being in the class to learn how this
Mhm.
stuff works. So there's that part of me that was judging, like, oh, that person who's over there, like, crying and flailing and making a big scene, they're just making it about them. I don't want to be like that. So I was definitely a bit judgmental about other people in the room and their intentions as well. But then in SER2, I was one of those people who was crying and flailing, and I was like, oh, this is happening to me, so maybe this is real too. Uh, so maybe with that segue, could you say a somatic emotional
That's
release?
fabulous. Yes,
What is
I
it,
can,
and how does
yes,
it fit in?
I can speak to somatoemotional release. I somatoemotional release is really not necessarily, I think that our focus in, when we see that term or we hear about that term, our focus is on the middle part. It's on the second part or the emotional piece. So the sandwich in between. And really our focus as manual practitioners is the soma, is the body piece, is the tissue piece. And all of somatoemotional release is actually focused on the concept of finding a place in the body where we put our hands that affects globally. So somatoemotional release is really just treating the body globally. Our invitation to the body is global. So as opposed to working in an area looking for an energy system that's localized to an area, it's a global invitation. And that's why restrictions are demonstrated, or if you like, energy cysts are demonstrated through the arcing, that maybe the patient, those aren't consciously areas that the person knows about. So they may not be historically known areas, or they might be quite known. Okay, those are both possible. And then the process is really about going, we talked about engaging the tissue, but going back to that basic idea of connecting in with the tissue and following the lead of the tissue as it maybe pulls us in deeper, supporting the tissue in different positions, and waiting for signs of tissue releasing. So, what makes it somatoemotional release is that sometimes with these restrictions, there is an emotional component which we can get very excited about, or we can just think about it as energy. And sometimes that emotional energy is released from the tissue, so from the person at the time of that treatment. Sometimes it comes out later. Sometimes there's some great tissue release, and later the person goes home and feels emotion coming up and allowing it to come out. And that could come in the form we often think about as crying, but could come in the form of laughing. It could come in the form of, some other type of emotion that just hasn't had a chance to be processed, hasn't, was held, was, you could say, managed within the tissues because the person did not have the resources to address it, to process it at the time that that energy cyst was formed.
Hmm. Yeah, and I like that you mention it could be laughter as well. It doesn't have to be this big, heavy
Absolutely.
thing. My first few craniosacral sessions, actually, I didn't know what somatoemotional release was at the time, but I was. Do you remember Ramona? I'm sure you know Ramona.
Yes, lovely, lovely person. Had so many fun multiple hand sessions with her. Yeah.
She's incredible. I think she was my first practitioner that I saw consistently on a monthly basis when I first got into this work. And it must have been the first three sessions. I'd just be laughing hysterically the entire way through the session. And I was like, I don't know why I'm laughing. I just need to laugh. She's like, that's fine. It's great. Let it happen. Um, so that was my experience, is that emotional release portion came out as laughter. And that was really interesting to me. It made me reflect on, why is it coming out now? Why, if this is something that has been held inside me, where in my life have I been suppressing this joy that's coming out now? And it really got me reflecting, and that's part of what I really loved about craniosacral in my life. Is it I always left a session with this awareness of my life as a whole, which was really cool, which can go
Yeah.
a long way beyond just trying to come in and manage some kind of symptom. Um, so with somatoemotional release, there's often you're following movement of the body, you're following movement of the tissues, and I've had experiences after I started receiving craniosacral therapy, where I've been doing my own, maybe you could call it meditative practice. I don't really know what I was doing. I was just lying on the floor and relaxing. And I'd start to notice that suddenly I would be spontaneously moving different parts of my body. And the first time it happened, I wasn't sure what was happening to me. I thought I was having some kind of neurological problem. Like, why is my arm moving? I'm not moving my arm. My arm is just starting to move. And it feels pretty good, so I'll go with it. But should I be concerned about this? And I mentioned Ramona earlier. I brought that back to Ramona. I said, hey, this is happening to me. What's going on? Because it didn't happen before I started receiving craniosacral treatments. And she said something along the lines of, it sounds like that's maybe a spontaneous somato-emotional release that's happening. And I don't fully understand how this works, but what do you think? Have you heard of this happening with other people as well? Is that a phenomenon you've encountered before?
Yeah, very cool. So I think what's happening, I had a patient and she had had bilateral knee replacements. And after we started working together, she told me a similar story, but it would happen in the tub. So she would get into the tub and her legs would start to, again, sort of move spontaneously. And she found it was very pleasant. It was comfortable. And how I would describe that is twofold. So one is when the muscle is relaxed enough, so we're not supporting against gravity, there is going to be fascial movement. And that fascial movement tends to not be particularly, it could be linear, but it often has a rotational component to it just because just the way fascia is, I guess, is a way to think about that. And if you want a beautiful reference for that, go on to Strolling Under the Skin, Dr. Jean-Claude Gimbertot. Unbelievable. Sorry, little segue. So back, uh, that fascial movement it only happens when we take away the muscle contraction or muscles working to work against gravity or maintain, manage gravity. So that's one possibility of why it will happen. And if someone has had cranial or an experience where I guess there's been some awareness that this is possible, maybe that encourages it a little bit. It doesn't happen to everyone.
Mm.
So clinically, there's one piece I do want to point out because this does, I think, separate craniosacral therapy and the concept of somatoemotional release. Somatoemotional release are just techniques within craniosacral, but it differentiates it from maybe some other types of practices in that there are so the importance of that fascial movement. And when you were, lying on the ground and it was happening, you were just allowing it to happen. It was amazing. One of the pieces that wouldn't be noticed was there may be some significant positions throughout that whole movement that wherein the tissue needs to be supported
Mm.
to give it a chance to, the idea is to give it a chance to release a vector of energy that has come in, right? That force that came into the body as, the person fell down the stairs, boom, 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 those vectors coming from the ground to into the tissues. And the idea of recreating the position of the tissue, which allows that force to exit or to dissipate.
Mm. Right, which is what we're trying
So,
to do with
right?
the somato-emotional release techniques is find those specific positions that have significance that
Exactly.
need to be re-experienced. Is that the right word?
Okay, so I love that you said that word so I can do a gentle correction of
Thank
it.
you.
A gentle, no, no, just a gentle remolding of it.
Yes, please.
And the reason, but no, there's nothing wrong with it. I think it's really excellent. It just gives us a great opportunity to make a comment about trauma, if that's okay, just for a second. And the concept of trauma involving energy or force that comes into the body from away, right? In the body not being able to manage that force because it is too great, or the emotional state that we're in at that moment, or the condition of the tissue, and we wall it off. And there have been many discussions by trauma experts around what is the best, most therapeutic, most facilitative, most helpful, compassionate way to help people with the dissipation, or if you like, with the return to health of these tissues that have been traumatized in this person overall who's been traumatized. And in the past, there may have been beliefs around the concept of re-experiencing. So I just wanted to grab that word. It's a great word that you brought up. And in regards to those techniques of samatha emotional release, the idea, the therapeutic concept is not necessarily around the re-experiencing of trauma to the extent that we want to be so incredibly careful that people do not become re-traumatized. I
Mm.
mean, that's just paramount, paramount in our minds around, the focus is therapeutic and facilitative. And interestingly, if you think about what is the goal of the somatoemotional release um, approach of the paradigm, if you like, of it. It is actually something that we talked about right in the beginning, which is connecting with self, or if you like, self-realization or self-awareness, right? Really connecting with ourselves and getting to know, just like you've referenced in regards to your experience of SCR1.
Mm.
Even having that incredible, I mean, it's mind blowing the awareness that you got, which was, holy cow, I'm really resistant to something going on here. That in and of itself, I mean, if that's all you got out of a session, that's magnificent. That's an incredible awareness. And that was awareness of self. No one came and said, hey, Monica, you're really resistant. I don't think you're getting it.
That would have not gone
Maybe
over well for me, to be
that
totally.
wouldn't have gone over well for with you at that time, I don't think. And that's that's a whole different process, therapeutic or otherwise. But the idea with this is that, that facilitating the reconnection, right? Self-awareness. Oh, oh, now I get
Mm,
it. That piece.
mm. And you, I love that you made this segue into the theme of trauma because I do have a question. I have two more questions, but one of the questions I have for you is as it relates to, the book, The Body Keeps the Score. And
Yes,
there's been a
yes,
lot
yes.
of talk lately about this. I don't know if you've seen. In
No,
particular,
I haven't read enough of it. I was teaching with a friend 2 weeks ago. She's a psychotherapist, and she was referencing it, and I did not do the research. So I am going to say I totally apologize.
that's okay.
So tell me. So
I
tell me,
haven't.
what's the stir?
So I also am guilty of not knowing exactly what the stir is because I'm really resistant. Again, that word resistant. I'm really resistant to when I read
Love that word.
headlines. I just don't want to read them. I'm like, oh, another stupid headline. I don't
Yeah,
care.
yeah,
If I get a primary source, I'm happy to hear information from someone that I
yeah.
trust, but I don't trust headlines on the internet anymore. But there's been a lot of fuss in social media, people that I see talking about, oh, the body doesn't keep the score. Bessel van der Kolk is wrong. Nothing in his book is grounded in science. Like things like that, which I don't know the details of. But I guess the main premise is that trauma and emotions are stored in the body. And I wonder if you have a better way of explaining it. How, in somatoemotional release, we talk about release, which means that there must be something to release. And where are these emotions in the body? Are they stored somewhere? And in SER, I think I remember the word memory, that there's a memory of emotions, but
Hmm.
in the body. But how exactly would you describe this to someone if they had said, "Oh, the body keeps the score and I've got trapped emotions in my psoas." How might you gently correct, or I don't know, are they accurate when people say things like that?
Yeah. Oh, yeah, wow.
I
Give
know
me
it's
a
a big
second.
question.
It's a really good question. It's a really good question. May I answer the one piece about what are we releasing? Would that be
Yes.
okay for a second? One of the ways I would describe that to someone goes back to Rolfing. Do you know much about Rolfing?
Yeah, yeah.
Ida Rolf, and there were some other practices that some people who kind of broke off from Rolfing and created their own versions of it. Can't remember all the names of them right at this moment. One was called NISA, which was an acronym for something. And one of the things, one of the pieces that was so interesting was that awareness of patterns of tension and how those patterns are held and how we hold them non-consciously. So I'm using that word really consciously, right? Just not conscious. Like, oh, was I holding my arm against my body? I didn't even know. Right? So it's not being managed on a conscious level. So in terms of release, what are we releasing? We're releasing patterns of tension. And if you want to step out of cranial for 1 second, you say, well, why are there patterns of tension? Well, they're patterns of tension because our ability to manage force in those tissues, it was too great. And so the body's response to protect itself is to increase tension. So now we have tension. And then step back into cranial for a second and we can talk about fibroblasts. And fibroblasts are connective tissue cells. And there's some incredible research about fibroblasts demonstrating that there is actually genetic change in the fibroblasts from tension patterns that the tissue is holding. And we can hold those patterns, we can hold them for a lifetime. Not great. And so, what are we releasing? One of the things I would, sort of argue is releasing patterns of tension. We're releasing tension patterns held within the connective tissues of the body. And then that connective tissue actually can remold. I mean, think about scars. That's incredible remolding of connective tissues, among other tissues. And so actually it's all connective tissues to be fair, because bone is actually a type of connective tissue. So scars are a beautiful example of that. So what are we releasing? We're releasing patterns of tension. We're releasing tension that is being held in the tissue. So want to go micro? It's being held in the cells.
Mm.
And how do the cells know to stay in that position? Because that information has been, I don't know, has it been maybe learned? I mean, think about injury. We learn very, very quickly when something bad happens. Interestingly, we release more acetylcholine when we have learning experiences involving something negative than something positive,
Mm.
which is why if something one of my friends was speaking about, darn it, what was it? It was I can't remember, it was some kind of food. It escapes me right this moment. And she had one bad experience with this type of food when she was a child. She has never eaten it again. One. It took one learning experience. Think about, I don't know about you, like if you're trying to learn something new, one and done, never.
Mhm.
I learned it. I did it once. I've mastered it. So the memory component is definitely there. And it is, you could say it is protective for us, right? It's survivalistic. However, in certain situations, it's important to behave in a certain manner because of that specific experience, right? Something that was going to keep us safe. So, for example, someone breaks their humerus and they have a cast. They can't move it. And that is therapeutic. And they're told, don't do this and don't do that right now. Okay. Don't do these movements. And so they don't do the movements. They have a sling on. Everything is good. And then after 6 weeks, it comes off. And in 6 weeks, neuroplastic change, the body's learned. Don't move the arm that way. And so they have to relearn. They have to consciously relearn that that pattern is no longer serving. And this is part of somatoemotional release is patterns that are no longer serving. So what's being released? You could say a pattern. You could say tension in the tissues. You could say the genetic information is changing in the nuclei of the nucleus of the fibroblasts or the nuclei of the fibroblasts. So that's, I don't know if that's a maybe another way of describing this.
Mm. Well, I love that you put something material to it. It always is a little off-putting for me when I hear people talking about releasing their, I don't know, name XYZ emotion from in a treatment. And like you say, whatever you're releasing, we're not releasing their emotions directly. We're working with their soft tissue. And would it be at least safe to say that maybe there's a memory of some emotional content that's intertwined with that soft tissue that can be remembered as that
Mhm.
soft tissue is experiencing change?
That seems to be the case. Yeah.
Okay.
And we could delve deeper into the concept of memory and cellular memory, which has really come a long way, I think, in terms of being more mainstream, right? The idea of cellular memory, and also now we talk about memory, obviously, DNA. Think about all of the information carried in DNA, and we talk about generational trauma, which doesn't even mean that is there actually even memory, right? Is that memory, stored in the DNA and passed along? So it seems that one of our setups for survival, and we're so hardwired for survival, but part of our setup for survival is remembering so that we can avoid the thing that was um, damaging or negative so that we don't let it happen again.
Mm.
And
And
if we
then,
can't remember, if there's nothing connected to that, we're either going to do it again or it wasn't really that bad.
mm,
Could in that way.
yeah. And when you say it that way, the drive to avoid, it makes me think of that would elicit a specific movement in the body, a
Mm,
withdrawal of some kind. And it could,
yeah.
in my mind,
Limit,
starts to,
limitation.
yeah, limitation. It starts to link together the avoidance of something painful and experiencing a particular emotion as a way of serving us in some way. Also, will have some kind of physical output in the form of a movement or a lack of a movement. And this
Yes.
is clearly above my pay grade, but I really love just trying to unpack it in a way that goes beyond a airy fairy fluffy way of thinking about it so that people
Yeah.
can have some real information about this is actually what's happening in the body and these things are it's a
Right.
real experience that people have and it's highly valuable to be open to it from experience being resistant to it and then being open to it and feeling the difference in my body so yeah I thank you for providing some context around that what we're doing and what we're
Absolutely.
not doing.
Yeah. I think the what we're not doing sometimes is equally important to explain because
Mhm.
there are practices that I think are maybe unsafe.
Yes.
And I speak to that as a practitioner, but I speak to that as a patient,
Mm,
right? Some practices that might feel unsafe. What's the therapeutic value?
hmm.
Um, as we talked about that idea of, the potential of re-traumatizing, which is we want to avoid at all costs.
Yes.
So I think that piece is important, and we bring it in somatoemotional release again, just being tools within or techniques within craniosacral. We want to bring it back to the body, right? We want to bring it back to what's happening in the tissues. The tissues are the issues, and that emotional energy that we're doing so much work to manage is disruptive. And even just, you know, trying to hold in trying to hold in a cough, trying to hold in a laugh, trying to, you think about how much force it takes to not speak. I'm going to hold my tongue.
Mm,
Think
yeah.
about even those pieces, how much effort is involved. And so if we're using all of that effort, all of that energy, our own energy, our kind of daily energy to do that, it's going to detract potentially from something else in terms of tissue health or tissue function.
Mm. This is why I wanted to talk with you, Nina. This is so good to hear you describe it. And I'm really thankful you've talked with me almost for, well, more than an hour now. And I just have one last question. I want to
Wow.
be really mindful of your time and
It
in
didn't
your,
seem like it. I feel
oh,
like
good.
I'm in flow. I'm in flow state.
Amazing. So, the last thing I want to ask you about is a little bit of a trend on the internet. Have you heard of looks maxing?
No, tell me.
Okay. I don't know much about it. Again, I think I have resistance to actually looking up, but I can't avoid hearing about it. But looks maxing apparently is this trend primarily in males of trying to alter their appearance
Okay.
through interesting means. And one of these ways of looks maxing, like maximizing your looks, is
Yeah.
called bone smashing. And you can watch videos of it if you are on the social medias and you look up bone smashing. It's if I look up what the definition is a controversial practice that involves repeatedly striking facial bones to achieve a more aesthetically pleasing appearance. So you'll see videos of people like pounding, hopefully not too forcefully, but trying to I think they're trying to stimulate bone growth. So make
Growth.
their
Okay, yeah.
cheekbones more prominent by stimulating, is it Wolf's Law that if you stimulate bone,
Right, right.
it will
Yeah,
grow?
yeah, yeah. If
So
you
there's
stress, beautiful. That's right. If you stress a tissue, the body will lay down excess tissue.
So it's actually in a way quite brilliant that someone has thought of this if they want to have a more attractive quote
For
unquote facial
sure.
structure. But I just wonder, as a craniosacral therapy practitioner, if you had a client come in and say, "Oh, yeah, I'm trying this thing called bone smashing,"
Yeah.
what is your thought about that, Nina?
Wow. My concern would be, again, back to the dissipation of force. And if that force is too great for the tissue to manage, then we're going to see a change in that tissue. So now you could essentially say that tissue is going to be limited in some way, right? So the function is going to be limited. Now, if we want to speak specifically cranially, if we have force that limits the movement of one of the cranial bones, and in craniosacral therapy or in osteopathic medicine, honestly, the one of the basic tenets is movement is health, and disease of movement leads to disease process. So the problem would be that if we're using force that is so great that it now limits the movement ability of the tissue, let's say in this case, particularly bone, then we're going to have potentially a deleterious effect throughout the cranium. Because
Mm.
if one thing isn't moving and it's this whole beautiful system based on feedback of movement throughout this system, then something being limited is going to have an overall effect. So I guess you'd need to do both cheekbones equally.
Nina's advice, if you're gonna do bone smashing, do it symmetrically. Well, no, what you say is very valuable if you're smashing on your zygomatic bones, which are connected to your maxilla, and you compress the zygomatic bones against the
Right?
maxilla, and then the maxilla connects to the sphenoid, and now your sphenoid can't have
Yes.
its flow into flexion and extension, and that connects into your occipital base, and then that connects into the dural tube and into the
Exactly.
spine. You could start to see connections in how you're starting to create some limitations in your spinal movement, which could create a whole heap of chaos.
Right?
So I don't
So
think that these
maybe,
people have
yeah,
thought about that.
probably not.
But at least they look great.
But, but they'll look good. So
Yeah.
that part's important to them, clearly.
Yeah. Well, Nina, I think we'll wrap up here, and I thank you so much for your time and sharing your expertise. And
Yeah.
I selfishly just wanted to ask you about all things craniosacral, and I know you do more than that. You are also a acupuncturist and a massage therapist and kinesiologist, and I didn't get to any of that, and I
That's
apologize,
okay.
but there's
That's
just not
okay.
enough time in a
Not enough
day.
time in the day. No.
So if people
Exactly.
want to get in touch with you, if they want to reach out and ask you anything, or if they want to come see you, if they're local in London and want to come see you, do you have a website that I can link people up to?
Yeah. Should we give the IHP one? Is that
Sure.
probably the good one? So that is I have to look at exactly. I do have a Jane. Should I just say the Jane? Let me do the Jane because I know it off by heart.
Sure.
And then that might get them to a website as well. So the Jane is my name, so Nina Chernick, Ninachernick. I think it's Nina Chernick dot Jane app. So janeapp.com.
Okay.
NinaChernick.janeapp.com. Does that work?
Yeah, we'll link to that on the page where people can find this podcast. And do you use social media? Do you recommend people find you there or no?
You can, I'm on Instagram, but I wouldn't say I'm particularly a huge follower on Instagram. But I'm on there, so my name is there somewhere. Might be my professional is Nina Chernick, manual therapy.
Nina Chernick, manual therapy. All right. Great. Well, thank you so much, Nina. This was really fun. Appreciate your
My
time.
pleasure. And I really, really appreciate your questions and your interest.
Aw, shucks.